So we're into week 4 of our road to 20 year 2. And this week, just meeting with Shane and Sandra, Sandra the practice manager, Shane the head physio. Again, quite frustrating from a business owner point of view with cancellations and COVID and stuff like that. So that's still presenting challenges within the business. So we're really working this week on, again, looking at our value chain, looking at the patients that have cancelled and did not rebook, making sure that we have staff members who are solely responsible for getting those back on track again. On the positive, the team have been absolutely fantastic this week in launching our longevity program. So that's again a strategic program that we've implemented into the clinic to give people the next step, obviously when they're discharged from pain. So they've done a great job on that. We've launched that. The team have been, as I said, they've been absolutely fantastic in reflecting on what went well, but also what we need to improve as we go and build this out and turn this into something that we're really proud of. So that's been really encouraging this week. In terms of the roles, what I've asked Shane to do this week is obviously just get really clear on exactly where the cancellations are coming from. Is there any common theme with that? Is there anything we need to do to support our therapists in order to prevent some of them? Or are they just genuine COVID cancellations and other bits with work, etc. as well? But the key principle that we want to adhere to here is that, you know, if we say we're going to do something with a patient and they come to us for help, we want to make sure that we give them that help, and no patient gets left behind, no patient falls off, and essentially no patient is leaving unhappy with not getting the experience that you know, they were expecting. Now, as a business owner, sometimes that can be hard, where you almost don't want to hear it, but you know, I've learned a long time ago, you're better off hearing it and it hurting a little bit, but using that as an opportunity to fix problems within your business. And I think sometimes as a business owner, it's very easy to put your head in the sand. I've certainly been guilty of that in the past, where you just go, okay, yeah, everything's fine. I'm not looking, okay? Whereas actually when you follow up every patient, you get the truth. That's where then, you know, the truth hurts sometimes, but as I said, it's a massive opportunity to fix some issues. Other stuff this week with Sandra, logistics, just cleaning up some stuff with discharged patients and some IT issues as well there this week. But as I said, overall this week, yeah, COVID continues to bring us challenges, but on a positive, we've made a big strategic move in introducing a new product essentially to our clinic, which, you know, you kind of have to delay gratification with this stuff. You know, you kind of want it to be full, and you want it to be, you know, 6 months time. But obviously these things take time, and I'd much rather implement this slowly, get it right, get a good tracking with our Net Promoter Score with this program, make sure that we're actually getting results, and then put the systems and processes in then that we can actually scale this on a much greater level. So this is very much the kind of the beta phase of our longevity program.
Afternoon, my name's Carl. I'm from the Pro Sports Physio team. I'm pretty new, but getting to grips with everything. I've been on the mentorship course and done also the refresher course, and it's been absolutely brilliant. I'm starting to implement these strategies now in the practice, and it seems to be going really well at the moment. So yeah, all good.
Also this week, obviously Carl has joined our team as well. He's made a fantastic start. Shane's working hard with him this week to get him up to speed, and he's already done a great job with a couple of patients who we've unleashed him on, and he'll continue to go through the Pro Sport onboarding phase that essentially we take therapists through on the mentorship as well. So Shane, as I said, he's doing a cracking job with Carl this week, and I'm just going to cover some stuff in our in-service training as well, particularly around shoulder pain patients, and just some stuff that I've been thinking about recently as we develop the step-by-step system. So I'm going to take the team through that now. My throat was going hoarse, and then I went like this. I went like that, and neck just locked up, and locked up for about 3 or 4 days, and it settled down a bit, but there's still a little bit here. So in this kind of area here, And it's just basically, I mean, you can completely assess me if you want. It's kind of these motions here when I'm sleeping. It just feels like it's hanging. So it feels like this shoulder, I can feel it. I can't feel it on this one, but it's almost like dropped. So what would you be thinking? I've got an idea what I need, but again, you know yourself, you can't
I feel like reaching down.
Yeah, but mechanism of injury. So I've given you the mechanism. So I've gone like this. Oh, and like really like retracted like that. And then when I let go, just everything locked up. So what tissues are you thinking based on what I've told you? So I've done that. I feel like I've almost got traction here. And when I'm walking with the weights, I can't really feel it sitting on this one. It's all sitting on this shoulder. So what are you thinking there from the mechanism?
Maybe like serratus anterior, retraction wise.
Yeah, lengthening.
Yeah.
Might be lengthening, but what's shortened?
In this position,
Yeah.
your wrong body. So.
Yeah, what else? My traps. Yeah, my trap.
Yeah.
So again, my traps, I would have gone like that, and everything's just locked up a little bit.
Does someone want to assess David first?
So test me there, Ollie. See what you
I
think.
did, well actually now, the position's going to put you in more like lower traps I think, so like in that
Yeah.
kind of range there, but
Yeah.
and press up against my hand.
Alright.
Yeah.
That's good. It's a good side. Yeah. But as well, check here. Okay, so upper trap here. Okay, so in this position here, my scapula is going to be upperly rotated, so I'm not going to get as much levate scap as well. So think about what you loaded or what you treated for me. The position you tested.
So like coming across body.
Yeah. So how are you
So
going
you
to
treat
get
it
that?
into that, so like go right across your body and then try and drag your fingers across.
Yeah, exactly. Or you could go this side. You've got this option as well.
Yeah.
Okay, so get my base of support here. So now all the weight's on my hand. So if I go here, there's no weight through my hand.
Yeah.
Okay, get it all here. And then push. Okay, now I have serratus. Or I could just do serratus pushes here. Okay, but I've got load through my serratus now. Now what can I do to my levate scap?
Stretch out to it.
Yeah, mobilize that, can I?
So you're trying to shorten serratus
Yeah.
and then lengthen.
Yeah, because
Right.
you could do that either way, probably the wrong way around there. But the more load I get through serratus, the more that's going to give.
Yeah.
They're on tangents, aren't they? So serratus going upward, you rotate. Left scap's going down, you rotate.
Right, yeah.
So yeah, it's week 4 of 75 hard. So it was interesting. I posted this week just the update, and somebody, I think it was Colin Gordon up in Scotland. He messaged me. I think I mentioned some about, most people at this time of the year, they've fallen back into their old habits, and they're expecting to get a different result this year compared to last year. Whereas it was around the day 19 that I felt, it started to make some really good progress. My wife was kind of saying, "Oh yeah, you look like you're losing weight and all this stuff," and you're starting to generally feel better. And it's interesting. It has to, the first 2 weeks, you just have to get through those first 2 weeks, and then you start to get onto autopilot. So I thought that was really interesting. And back to my point, Colin, he put in the group, I think it's day 19 or day 17, he said that something like 800 million people on Strava sack off their commitment goals. I think it's 19 days into their training plans, which I found astonishing. And I think that really reinforces the importance of consistency. That it's the ability to delay gratification, get through that bit. So day 15 to probably 19 were quite challenging, but once you get past that day 19, things are on autopilot. And this week, to be honest, it's just habits. I'm really enjoying the walks, the weighted vest walks especially. I've gone back Gaelic football training, and I've actually noticed that my fitness is massively improved, and I think there's probably something in it with that as well. But as I said, at the moment, it's all good. This week is more of a normal week anyway for me, so fingers crossed it should be pretty straight sailing. I think the The trickiest time has been Saturday evenings. That's kind of where, you know, you're kind of waiting to get crisps and chocolate and a few bears down you. So that's probably been, completely honest, the most challenging time in the last 2 weeks has been the Saturday evenings. I've tried to go for a run, kind of tea time-ish, and then, you know, have a shower and stuff like that, and then have dinner. But it's when you finish your dinner then that you're kind of your brain is kind of calling for the junk food. But other than that, all good. On a focus point of view, I've been very, very productive this week. Sleep's a lot better, recovering a little bit better as well now from the 2 workouts a day. Getting a lot of work done, and from a strategic level as well, just being able to stay focused on the main thing has been really good. So definitely getting the benefits of not having alcohol in my system, no sugar or excessive sugar or anything like that. Sleep's a lot better. My resting heart rate's dropped massively. I wear an Oura ring anyway, so I track that. Resting heart rate's dropped massively, especially when I sleep as well. So that's all positive. Week ahead, next week, as I said, it's a pretty standard week. We've got a few more weeks now, and then when I go to Ireland in the back end of February, that's going to be probably the biggest test of all on this challenge. But so far, so good.